Welcome. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. In the April issue of Pediatric Critical Care Medicine, we have 5 feature articles, each with editorials, 6 other original articles, a research review, a PCCM conference report, an editor's note, a research letter, and endnote material. So, the feature articles, first by Mitting et al., a post hoc analysis of the Sandwich study focused on bronchiolitis. There were 784 such patients, so well worth looking at. The second feature is a post hoc analysis of the HALF-PINT trial focused on those with primary neurologic injury by Lariver et al., 64 of those patients. In the third feature article, there's a daily surveillance blood culture on ECMO study, single center, 111 patients, over 1,000 cultures by Schmoke et al. The fourth feature article is fluid management bundle in patients with respiratory failure, over 200 patients, defined as requiring IMV for longer than 48 hours by Foglia et al. And the fifth feature article is central or peripheral VA ECMO for sepsis. This is an ELSO database study 2000 to 2021 by Totopalli et al. In the other clinical studies, there are 6. Just the headlines here. Kalata et al. Have done a pre-planned secondary analysis of the more than 3 days invasive mechanical ventilation. And here the authors have focused on change in caregiver employment. Smith et al. Have looked at family presence at the bedside and development of delirium in a cohort from 2014 to 2017. Ray et al. Have done a post hoc analysis of the PICU trial data set, oxygen targeting conservative versus liberal, and they focused on those patients with severe oxygenation impairment. Rudolph et al. Have done some physiology for us, and they've looked at airway occlusion pressure and P0.01 as measures of inspiratory effort and respiratory drive in invasive mechanical ventilation. Bradley et al. Have looked at meropenem exposure in septic shock patients with a PK analysis. And lastly, Rennick et al. Have done a 3-year follow-up study of the Caring Intensively study cohort from 2014 to 2018, with now a focus on psychological and behavioral outcomes post-PICU. The research review by Hay et al. Is on PTSD in PICU survivors, looking at the literature from 2000 to 2022. The PCCM conference report and expert panel by Samuels et al. Is from the Bright Star group looking at endotracheal aspirate cultures. My editorial note looks at what's new in PARDS research since PALIC-2. The research letter is on bubble CPAP and dexmedetomidine for moderate to severe bronchiolitis. And then the endnotes, a PCCM narrative called My Perfect Son by Melanie Johnson, and the in memoriam to Shari Simone, who was a senior leader, teacher, and mentor in pediatric advanced practice and pediatric critical care community of professionals. So that's all for this month. Huge amount of content. Do enjoy, and I will see you next month. Thank you very much.